Okay, right. Well, thanks everyone for joining us, and welcome to this exciting event, which is an introduction to Breathworks Mindfulness with Stanter Kandola, hosted to you by Footsteps Festival, which is a year-long festival which is bringing a range of exciting events celebrating living well with pain, and it's co-produced by lived experience and healthcare professionals in the pain area. I'm Mark Angelo. I'm a lived experience organizer with the project, and my colleague Nikki Jones, who's handling the technical side and doing a lot of hard work behind the scenes, is also a lived experience person. I'm just going to quickly, before I introduce Stanter, I'll just remind you about the usual ground rules. So please stay on mute throughout until you want to speak later on when that becomes an opportunity. And if you've got any questions or any comments, please do put them in the chat, and we will be monitoring that, and we'll check that and bring those in at the appropriate point. So yes, our brilliant presenter today is Stanter Kandola, and Stanter is a highly experienced mindfulness teacher, and she embraces a holistic approach to health and well-being. She's also a qualified manager, adept at coaching and training delivery, and has been involved in developing services, playing a leading part in developing a pain clinic in West Yorkshire. And Stanter is the head of programs at the Breathworks Foundation, which is a charity committed to helping people living with pain to reclaim their lives through a blend of mindfulness and compassion training, courses and events. And so this session, which is the second of two, is entitled Managing Pain with Ill Health. Managing Pain and Ill Health with Mindfulness. And Stanter is going to build on the foundations of the last session, which had a slightly broader introductory feel to it, and so to now focus more on the application of the technique of mindfulness to health matters. So, with no further ado, I'd like to hand over to Stanter.
Mark, thank you so much, and welcome to everyone. I'm really excited to be here for part two of the work in terms of the introduction to mindfulness, really. So what I wanted to do was build upon the last session, which was like the foundations of the breath, understanding why breath is so vital and how we can really learn so much with how our breath is, in the body, and to be able to anchor ourselves in the breath. So that was the last session. This session, as Mark said, I'm going to focus a little bit more on different aspects of mindfulness. So there's going to be some ideas we're going to discuss. We're going to do a little practical exercise as well to kind of get us closer to this idea of what is mindfulness? How do we become mindful of activities, of our day-to-day kind of experiences in life that we have? So, and then how that applies to working with pain, working with ill health, working with stresses and strains that we have, because that is life, right? Life will always have these aspects to it, struggles to it, joys to it, but it's how we ride out those waves that really make all the difference in the world. And mindfulness is a wonderful way of integrating our experiences. So I'm going to just quickly share with you a PowerPoint. So I'll be coming in and out of sharing this with you. So just a second. There we go. Okay. So in today's session, we're going to start with a pause like we did last time, because it's really important, no matter how much time we spend with each other in this session, that we have these little moments where we can just drop in our awareness to what's actually going on for us in the body in that moment. It's a great way to make a start. And then I'm going to do a quick recap, because I can see many of you were here in last session, so I don't want to repeat everything that I talked about in discussing what was mindfulness, what's the evidence, but I'm going to quickly kind of run through that for anybody that's new in the session today. And then we're going to lead into doing a mindful activity, and that's where we have the raisin or a piece of fruit, depending on what you have. And then following that, we're going to really explore in the most kind of simplest way this idea of the primary and secondary experience. So we won't go into massive detail, but you'll get a good sense of why so much suffering happens, and that actually there's something we can do to reduce that suffering in ourselves, even if we have pain, even if we have ill health. And then after that, we're going to end the session as we did last time with a meditation. And this time it will be the body scan meditation, hopefully leaving a little bit of time for a Q&A at the end of the session. Okay, so I'm going to come out of sharing here because we're just going to, right. So let's do a mindful pause. We're going to do it for about 3 minutes. It's not going to be very long, but it's enough to really get us into this sense of checking in, you know, what's really going on for me. The invitation is there to close your eyes, but if you don't want to, that's absolutely fine. And just perhaps lowering your gaze to something in front of you, so we're not actually focusing on anything, is absolutely fine. But if you're comfortable to close your eyes, let's all close our eyes, if that works for you. So as we close our eyes, I want you to just kind of really notice any sounds that are around you. Just having a sense of the environment around you. So it might be the sounds, it might be the pressure or the temperature of the room. And then I want you to take your awareness a little bit further, closer in to the body. So having a sense of your body seated. I can see most of you are seated. So feet on the ground, bum in the chair. Just having the sense of the weight of the body. And perhaps even noticing the sensations of your clothing against your skin. Is it soft? Does it feel comfortable? And then if you're able to just kind of dropping the shoulders, you know, just letting them, let gravity take the shoulders, so we're not kind of holding them up against our ears. Relaxing the jaw, allowing the brow to kind of unfurl, to just soften and open. And then let's take our attention further down into the body. So just noticing the sensations inside the body. Perhaps we can feel the sensations inside of our hands. There might be some tingling, there might be some pressure. Just being curious of what you notice, what is happening in your experience right now. And see if we're able to just allow it to be what it is, even though we might want it to be different, just allow it to be what it is, just with a real tenderness of knowing that this is just how my experience is in this moment. And perhaps taking our attention a little bit further down into the feet. What are the sensations in the feet, if any? And then now I'd like you to turn to your breath and taking in 3 slightly longer breaths into the body so that we're not forcing it, but just slightly longer in breath, slightly longer out breath. So we really have a sense of the breath and the breathing body. You can feel the movement of the breath. And perhaps even having an intention that with each out breath, there's a sense of letting go, a sense of releasing any tension. And just softening into the experience. And after you've taken your 3rd breath, allowing the breath to just center, just allow it to be natural. Just noticing how the body feels now. Just having a sense of the whole of your body, sense of being in space, in this space, in the room that you're in. And just broadening that awareness now. Seeing if there's a shift in how you feel compared to when we first started, when perhaps you first entered this space. And then opening your eyes when you're ready. Great. So as I said, it's a great way to check in, to land, because often we're so kind of reaching up like that, away from ourselves. So it's a really lovely thing to do. And you could do this in 30 seconds, in a minute, 5 minutes, 10 minutes, whatever feels right for you. Okay. So I'm just going to go back into sharing my PowerPoint with you again. And going to, because we've already had the introductory session, what I want to do now is, for those of you that perhaps weren't here, just to quickly go through and recap the basics of what mindfulness is and just some of the evidence. So what is it? So mindfulness is really about paying attention in the present moment. So what's happening right now, and that my attention is very purposeful. Yeah, that I'm noticing perhaps what's going on inside my body, the tensions that might be there, the sensations that are arising, things that are happening. There's kind of the fluid nature of the sensations inside the body, kind of really having a sense of noticing, being alert to, being curious to my experience. So the body, what's happening in my environment right now. And also keeping an eye on what kind of thoughts am I having? Yeah, am I getting caught up in my thoughts and my feelings? So it's a really simple idea, and yet it can be quite complex when we begin to play with it, when we begin to kind of see, well, how can I be mindful? Yeah, how can I land in the present moment? How can I do it non-judgmentally? How can I do it with kindness and care? So that's what we want to be able to do in terms of what mindfulness is. So what is the evidence? As you can see from this image, there's been more and more publications, medical publications, showing that the power and the evidence of mindfulness as a wonderful tool to aid our well-being, to aid our health, to aid our relationships, within the workplace, schools, all kinds of stuff. But if you can look at the chart, you can see that really, even though some of the reports were done, research was done in the 1980s, but really it's only in the 2000s that suddenly more and more people are interested in this topic, and much more is researched in this way. So we know that it has an improvement in the mood and well-being and our quality of life. There's a reduction in stress. Rumination is kind of overly thinking about things and kind of being caught up in our negativity, in our negative way of thinking about things, and it can cause burnout. So it can have a reduction in that. There's an improvement in attention and emotion regulation skills. There's an increase in attention, focus, and concentration. So imagine that, if we're really able to tune into what it is that we're doing and not be pulled in our attention by other things, when we can have more than 4 or 5 things that we're kind of getting to do rather than focusing on the one thing. It has an improvement in self-awareness and awareness of others, improvement in memory and learning skills, in health outcomes. And really there's this other angle that really, for us at Breathworks, is a really important part of it, especially when it comes to working with pain and working with ill health, is that sense of cultivating care, kindness, and compassion towards ourselves and others. Now, this information was taken from the Mindful Nation UK report that was done in 2015. So kind of really up-to-date research is actually showing the huge value of mindfulness in many aspects of our lives. Now, in terms of relationship to what we're here for today, is kind of that relationship to pain, like how effective really is it when it comes to pain? So we can see here that some of the studies that were done have shown that it's as effective as, for some people, it is as effective as prescription painkillers. There were some people that reported that actually was powerful as morphine. They were able to reduce the amount of painkillers that they were taking as a direct result of now beginning to practice mindfulness. There were changes in the brain structure so that pain is no longer experienced with the same intensity, and that's a really important part. So mindfulness doesn't necessarily mean that you will no longer have pain, but really it's a relationship to pain that means that it doesn't have the same impact in how we experience it. Can really help us to live with pain in a much more balanced way. And then the reduction of pain and the emotional reaction to it, again, another slightly different angle. Now, we know that there is now studies have shown in the UK, 1 in 5 people live with chronic pain. 1 in 3 people live with long-term health conditions. These are huge, huge numbers that people are living with. So we also know that if we're just relying on medication as a way of working with pain in particular, that it's just not as effective. Yeah, pain management is good when it's acute pain, short term, it can be very effective, but with long-term pain, often the body will get used to the painkillers, get used to the medication, and then we want more, and then we're looking at side effects and all kinds of other problems. So there has to be another way that we begin to work with our health, begin to work with pain. The other thing, to say about pain is we know that the pain, when pain happens, it's basically the nervous system sending out signals. They're saying there's something wrong with the body. Yeah, something needs to happen. And that's great if you've banged your toe or broken a bone. We know that pain, it's intense, and the body's very good at sending out those signals. But what happens when some of those signals begin to be overly sensitive? Yeah, so the nervous system gets very good at producing the pain signals, and it gets even better at kind of learning to produce even more. So that kind of sensitivity with which it can develop can cause all kinds of problems, because you're experiencing as pain and difficulty, and yet perhaps the damage is no longer there in the body. So where initially there might have been an injury, for example, and then after 3 months, 6 months, the injury is often healed. But unfortunately, that the pain signals continue to be sent out. So we have to develop a different relationship to the pain body. It's almost as if we have to retrain the pain systems to be less protective. Now, what we know from the most modern research done on pain is that the sensors of pain that are being sent out, or how we experience pain, can be impacted by how we feel, can be impacted by the thoughts that we continue to have. So this whole relationship has to be looked at that can help us to perhaps redefine how we live with our pain bodies, redefine how we live with the long-term health conditions that we might have. Okay, and I think really mindfulness, and certainly my experience has been the case, is fantastic at redefining, helping us to kind of really look at, okay, I know that my body is sending out pain signals, but there is no damage in my body right now. So what are my choices? How else can I relate to the body and the pain that I'm experiencing now? And some of that might mean having to do exercises, but actually learning what your body is capable of doing. And also recognize that sometimes pain isn't always bad. There can be good pain as well. So when the body is being stretched and exercised, that can often be the good pain, because we're not used to exercising our body. Because when we get in pain or when we have ill health, one of the things we do is we tend to kind of stop and slow down. We tend to stop working with our bodies. It's really important to kind of recognize that. So we looked last time about the core skills, allowing. So this is an attitude of kind of really being present to what's happening and being honest with the fact that, okay, you know what, I may not want to feel this way, I may not want to have this pain, but this is the truth of what's going on for me right now. Can I face that? Can I accept that this is what's going on for me in this moment? And therefore I can perhaps have a kindly attitude towards my own suffering, towards my own body, or towards my own illness, in the same way that I might do towards a child who's hurting, or a good friend. How would we attend to them? And can we attend to ourselves in that similar way? The other skill is inquiry, that sense of being curious about what's really going on, being interested in the moment. And when we are able to be curious in this way, and really noticing what's actually happening for me, we are then able to choose how we want to respond, rather than living in that kind of autopilot way, which is kind of like living through life in a daydream, not really understanding what's going on and the choices that I might have, and instead perhaps living in reaction to things. The third part of the skills that we develop is the meta-awareness, so the sense of self-awareness. So I know I am thinking right now. I know I am feeling right now. I know. So it's a sense of stepping back and noticing what's happening in my experience, in my thoughts, my impulses, my desires. And again, this can give us a great deal of knowledge. And again, this sense of an ability to be able to lead towards change that could be very, very effective and helpful towards helping us to live in that kind of balanced life. Okay, so now I'm going to come out of sharing this. So we're going to do a mindful experience. So now you've all got your raisins, or we'll have some small piece of fruit. Okay, so this is a way to kind of develop a mindful way of being with something. So what I'd like you to do is I'd like you to hold the raisin in the palm of your hand. Okay, and as you put the raisin in your hand, I want you to notice first that there's contact between the raisin or the piece of fruit that you might have and your hand. There's a slight weight to it. There's a little pressure that we feel from it, right? So there's a weight to that. And then if we kind of allow ourselves to look at the raisin a little bit closer, we will notice that there are ridges, that there's lightness in color in some areas, dark in another area, that there is light that shines in different ways. So there's some light in some areas and not so in other areas. So there's actually a lot of different things going on when we're able to just look a little bit closer at the raisin. And then if we pick it up, again, just sense of like how lightly we have to hold that in our hands so we don't squash it or drop it. So just kind of applying the right amount of pressure to be able to do that. And then what I'd like you to do is perhaps take it to one of your nostrils and just have a smell. And I want you to kind of really allow yourself to be curious of this experience. You'll have seen a raisin before, you know what it tastes like, you know everything, but really this time, see if we can really allow ourselves to be present to what's happening in this moment, rather than our expectations of how we have experienced this in the past, okay? And you might notice as well that one side you might smell more than the other, or there might not even be a smell. So just how is that for you in this moment, okay? And then if you're able to, whatever it is, and I know with some of you got fruit that you might not be able to, just kind of take it to your ear and just roll it in between your fingertips and seeing if there is a sound that you can hear from the raisin. So just taking that in and noticing if you've got any thoughts that are coming up as a result of taking in the sounds that you see. And then what I want us to do, is take that raisin and just begin to pop it into your mouth. Be mindful of the fact that you might want to chew, but just hold it in your mouth, on your tongue. Again, noticing where it's placed, what the mouth has to do, tongue has to do, so you don't swallow it. You might notice as you put this in your mouth that there's a tendency of wanting to bite into it. There might be saliva that's beginning to build up as a result of that. So now just rolling it in your mouth, just seeing how it feels, what's the texture like. And then what I want you to do now is begin to take a bite. So just noticing how it feels to take a bite of the raisin. What about the taste? What do you notice about the taste, if anything? And then again, just slowly taking further bites into that raisin until it begins to pulp. So don't just swallow it straight away. Let it just really get to that pulpy stage, really chewing it, staying with the sensations. It's really important that we really fully attend to the sensations of the flavors that are being released. And as you chew this, what do you notice about, do the flavors stay the same? Do they change? And as you completely just chew it, there's hardly anything left now. And then noticing how it feels to swallow the raisin, the fruit that you're trying out. Again, the muscles in the throat work perfectly to be able to take that liquid, take the pulp into your body as you swallow that. So just noticing how that feels. Brilliant, thank you. So just going to ask a question or two, so I hope that you don't mind sharing what your experience was like. So how was that to do that? What did you notice?
Mine was a bit different because I had an apple.
You did, I noticed, yes.
I was like, oh no, I forgot my raisin. I got an apple. So
okay.
I didn't go for the whole apple.
No, I'm glad you didn't try to put the whole apple
No,
in
didn't
your
try the
mouth.
whole thing. But it was really, even with that, it's fascinating to taste how normally just crunch an apple, eat it, gone.
Yeah.
It was when you said like to keep chewing it and notice how the tastes change within it. It's something I've never done before. Notice how when all the juice is gone, the actual taste of it is sort of like woody, sort of still apple, but not the same sweet sharpness that comes with it.
Right.
So you used to do a study like that before of for weight loss mindfulness, of the food of supply, of thinking where that food grew. Yes. And everything, and then on to the taste, and so even go even further, like to the raisin, like on the vine as the grape, and all the way down.
Absolutely.
Yeah, just fascinating. Yeah, really. It would take me a while to get through a whole apple.
Well, thank you so much.
But it was really enjoyable.
That. Yeah, great. So it was enjoyable. You were able to kind of really stay with the flavors as the flavors began to change. Now, what do you think is the purpose of why I'm taking you through doing this exercise in this way? How does it relate to kind of the broader life that you live? What's the purpose of that, do you think? Scarlett, do you want to unmute yourself?
For me, it's just being super aware of everything, like everything in life. So if you really concentrate on a small thing, it helps you to develop becoming super aware of everything else. Rather than just being like this and just doing it.
Okay, so it kind of develops this sense of being alert to and awake to all the different things that are going on in your life. Yeah. Okay, great stuff. Anyone else? What other reasons might this be a good thing to do? In what way can we adapt having that similar way of noticing, of exploring? Yep, Mark.
Yeah, just to bring in something from the chat, which sort of has a bearing on that. And Pallavi says it's a brilliant exercise and never concentrated on anything in that way in the detail before. And it's such a small thing and so much power. So yeah.
Thank you, Pallavi. I mean, that's the thing, isn't it? Because when you were doing that, I would imagine for most people, they were actually just really focusing in on what their experience was in that moment. They probably didn't have a lot of thoughts about thinking about this, thinking about that. Nothing else was going on other than being present to the activity that we were doing. So basically what the amazing thing about us, the way we work is that if we are really focused in on something, then our brain and our mind can't then go off and think about this, that, and the other and other ways. So it's a really great way if you think about, if I'm being with my family, my friends, if I'm doing a piece of work, that if I can fully attend to the thing that I'm doing, there's less likely, the stressor factors are less likely to be impeding what it is that I'm actually doing. So it's a wonderful way of kind of direct. And then also the other beauty of doing this is that you really actually get to have the direct experience properly. It's like, I'm sorry, is it Maria Bates? Sorry, because it only says Bates there.
It's Toria
was saying earlier about how actually her experience of the taste of what the apple was quite different than what we expect. So there's a whole thing about our expectations of what we think things are because they're familiar to the lived reality of that moment and what it actually is, so that we are making decisions and choices on what the actual experience is rather than the expectation. And that can go with how we work with our pain, how we work with our ill health. Okay. So what I want to do now is kind of begin to explore an idea with you. So I'm just going to quickly share the PowerPoint again. Okay. So what I want to do is this idea called the primary and secondary experience. Sometimes it's called primary and secondary suffering. And we're going to look at how this idea translates into reducing our suffering when it comes to the way we relate to our pain in particular and our difficult circumstances. Okay. So when we are talking about the primary experience, so the primary experience in any given moment is the basic unpleasant sensations, the things that are happening in that moment. So it might be the environment we're in, they are often body-based, the primary experience of the different sensations that are arising, maybe some of the emotions that might be there, and it's the experience that's happening in the moment. Often when we are having these difficult, uncomfortable experiences, we have a tendency to resist, to push away, because we don't want them. Yeah. Why would we want to be with pain? Why would we want to accept ill health? Because it's not nice. We don't like it. So that resistance causes tension, that sense of resentment, that pushing away from the reality of our experience. And when that happens, we have this secondary experience. So the secondary suffering arises as a result of that. And that secondary suffering, secondary experience is really there in terms of how we think about the primary experience. It's how we interpret the primary experience through our emotions, through our thinking, and then our behaviors may well change as a result of that. Okay, so to explore this a little bit further, we're going to do a little enactment to hopefully that you can see what we mean by how we work with the primary and the secondary experience. I'm just going to come out of I'm going to stop sharing because I'd like to see people when I can. So Mark is going to help me explore this idea a little bit further. So Mark, would you like to tell me what your primary experience is right now?
Yeah, so my primary experience is pain, and it's pain mainly in my elbows to my hands. It's nerve pain.
Okay, so Mark has some nerve pain, not very nice, I imagine. Don't really like it. It's uncomfortable stuff, might be really, really painful, but you can't get rid of it, right? It's something you can't get rid of. Okay, so would you take a cushion which represents your primary experience, and that is the pain that you are having right now in your hands up the way to your elbow. There it is. So now Mark has a cushion, and that's a representation of his primary experience. Okay. Now, Mark, if I asked you to get up, go to the other side of the room, pick up a pen, bring it back, would you be able to do that?
I think I could, yeah.
You could do that. It's a bit annoying because you've got this cushion, this primary experience you've got to wield around with you, but you could do that. Wonderful. Okay. So Mark, if I was to say to you now, thinking about the secondary experience, the things that we kind of then add upon the primary experience, what kind of secondary experiences, suffering are there with you right now as well? Or have
so I feel a sense of frustration and not being able to do the things I would normally for my pain.
Wonderful. So this thing gets in the way. Yeah, it gets in the way of your life, and there's frustrations as a result of that. Okay. So could you now put on another cushion on top of the primary? Okay, wonderful. Now, is there any other secondary experiences, secondary suffering, the way you might think about something or the feelings that it's bringing up as a result of having primary experience?
Yeah, I experienced some depression as a consequence of my pain and my situation I'm in.
Right, so now there's a sense of the frustration is there, and then it begins to impact your moods and low moods and perhaps even depression as a result of that. So could you put on another cushion on top of that? Now, it'd be really nice to get other people's thoughts here about what, think about your pain if you're someone who's had pain or is experiencing pain. So we know the primary is the thing we can't get rid of, is the experience that we have. And then the secondary is how we relate to it, yeah, our thoughts around it, our feelings around it. So what other secondary experience could we be adding on to Mark's here right now? Is there anybody who'd like to have a go? What thoughts and feelings would we be likely to be feeling as a result of having this pain that we can't get rid of?
Trapped.
Great, thank you, Delia. So this sense of being trapped. Okay, brilliant. So Mark, could you add on another cushion there? Brilliant. Any other? What then starts to happen if we start to feel trapped? What other emotions start to perhaps now build up as a result of that?
We start to lose ourselves behind everything else.
So your sense of losing ourselves, just kind of overwhelm begins to happen. Yeah. Just seeing some sorry, I'm just noticing this in the chat. Somebody is saying exhaustion. Yeah. So having that on as well, now we're just feeling utterly exhausted, probably from all that thinking, from all the pressure that we're putting on ourselves. Yeah. And somebody's saying, do you start to cry? Deborah says you might start to cry. It's feeling really, really emotional as a result of that. Yeah. It just becomes, and we've got frustration again. So Mark, how are you feeling right now? How are you
resentful?
Doing? Resentful.
Yeah.
Yeah, resentful. We can be resentful. So okay, so now can we see how all of this begins to pile up on top? Mark, how are you doing?
Yeah, I'm struggling to operate at all.
Yeah. So how are you feeling with all of this secondary experience, all this secondary suffering on top of what you already had?
Yeah, it's overpowering.
It's overpowering. Yeah, absolutely. Now, Mark, if I was to say to you to gently let go of all the secondary, just let them fall by the wayside, just gently let them go, just so that you're left with holding the primary experience. How does it feel now to just be holding your primary experience?
Yeah, it's a lot lighter, a lot more manageable.
A lot lighter and a lot more manageable, absolutely. So what we're saying here is that we don't get rid of the secondary. What we're saying is that that's a normal way that we will react. Yeah, these are normal experiences, our thinking, our emotions, in the way that we build up. But with mindfulness, what we learn to do is that we recognize that the primary experience is what it is. So I'm just going to quickly share with you my slide on this bit. Yeah. So what we're really doing with mindfulness in this particular scenario about the primary and the secondary experience is that the primary experience, we're learning to accept that, you know, this is how it is. I have this pain. How can I be with it? Yeah, I can't push it away, can't run away from it. It is what it is. So this sense of acceptance that in this moment, this is my truth and this is what's happening. And when we begin to do that, it actually really begins to soften and dissolve our resistance, so that we know that when we're pushing something away or with resentment, that actually builds up more tension in the body. That actually builds up more stress in our body. It can then, as we saw when Mark was building, those cushions were piling up, it has an emotional reaction to it, like resentment, feeling low, perhaps even feeling anger at ourselves for having that. And then that will impact the pain. Yeah, the pain will then feel worse. Our sense of being able to cope in life can feel as if it's overwhelming and we can't relate to life in that way. Okay. So what we're really doing is, by recognizing to be with the primary experience, there's my resistance. How can I soften that? How can I notice that it's there? We can use our breath. We can use our tenderness, our kindness to be able to soften towards that by saying, you know, yes, I am suffering. And this is the truth of this moment right now. So how can I attend to that? Yeah, what's the kindest, gentlest way I can attend to that? Because being harsh and critical of ourselves only causes more damage. And then by doing that, by returning our awareness constantly back to the primary experience, and that's what we learn in mindfulness. That whenever we have the secondary experience, I'm getting too, this is overwhelming, I can't take this, it's not fair, you know, why me, is to kind of just return again and again to the primary experience, to just be with and notice. And then over time, what happens is, as we see here, the mindfulness helps us to reduce and overcome the secondary experience. So it begins to lessen in how we experience that. Yeah. So, so it really is, and I know it's not, it feels like quite an easy thing for me to say that we return to the primary experience. But it is difficult, there's no doubt about it, because we're dealing with our emotional reaction to things, and there's the resistance. Why should I have to? Yeah, why should I have to be okay with what I've got? I don't want it. But if we carry on like that, it only makes our life worse. Perhaps being curious of softening that and resistance of saying, well, what would happen if today, in this moment, just for the next 10 minutes, I wasn't resistant to my pain, I wasn't pushing it away, and instead I'm able to accept that in this moment, this is the truth of my reality, and can I allow myself to be in this moment and see what happens. For many people, when they begin to work with their pain, work with their ill health in this way, they will find that their pain experience reduces, their relationship to the pain changes, and it certainly has done for me. You know, I've had pain for 37 years. I've had extreme pain for more than 20 years. It's far, far less right now. And I really do put that down to being on really good medication that actually works for my system, but also in the way that I work with mindfulness, in noticing what's actually really happening in my experience, and that I have a choice in how I want to respond to the sensations, the experience that I'm having, rather than be in reaction to or be in autopilot to, because that's often how we live through life. Yeah, being on autopilot. So like we did with the raisin exercise, that sense of being really close up to the experience. And what can sometimes happen is that we have this sense of, oh, this pain is overbearing, it's everywhere. Yeah, because we're used to saying that. And then yet when we look a little bit closer, we might find that actually it's undulating, it's changing, that it's in this part right now, and the sensations, as much as they're really uncomfortable, there's also something perhaps pleasant or okay about my experience, or the sensations are changing from really intense to then being kind of okay again. So that information is really, really important for us to be able to manage our pain bodies, to be able to manage ill health that we might actually have. Okay. Okay, so I'm just going to come out of that. 1 second. Okay. So we're going to go into a meditation. I was kind of always wanting to ask, see if there was any questions, but I think we can wait till the end to kind of allow ourselves to kind of digest that information that I've just shared with you. So let's move into a meditation. So I'm going to lead you into a body scan meditation. And it's going to last for about 10 minutes, so not very long. And I just want to kind of say, for those of you that are new to meditation, those of you that might have any trauma experiences in your life, that when we're meditating, please, if anything begins to show up in any way or feels really uncomfortable, I would like you to open your eyes. I would like you to just take a breath or two and just notice what your space is like, be able to name a few things if you need to, and just to slowly anchor yourself back in again. Okay, so there's no need to have to force ourselves to stay with anything. Mindfulness is really, really wonderful at supporting people with trauma, but you have to be very skilled in how we work with people that experience those things. So if you are comfortable, again, just finding a place that feels really, really comfortable for yourself, knowing that you're not going to be disturbed, knowing that you're safe. And again, the invitation is to close your eyes and drop your awareness into your body. So just really, again, this, as we did with the raising exercise, just that sharp focus of what's happening in this moment for me right now. What's happening with my breath? Does the breath feel even? Does it feel deep? Does it feel shallow? Where do you notice the breath in your body? Is it just in the nostrils or the chest? Just having that sense of the lungs expanding and filling with air. Or perhaps even lower down in the belly. So just spending a moment or two with our breathing body, just that sense of the ebb and flow of the movement of breath through the body, feeling the sensations of the breath. But we don't have to try and alter our breath in any way, but just allowing ourselves to be still with however the breath is moving right now. So there might be a sense of the expansion of the rib cage, not just at the front of the body, but at the sides and the back of the body. As we breathe in, the rib cage expands out, and as we breathe out, the rib cage contracts and releases. There might be a sense of the movement of the belly extending out on the in-breath and contracting on the out-breath. Just this natural flow of movement through the body. And that with each out-breath, there can be a sense of releasing and softening. Each out breath, you can even allow the body to be a little bit heavier. You can really feel the body releasing into gravity. And then now let's take our awareness down into the feet. Perhaps the feet are flat on the ground. Noticing the sensations. Yeah, tops of the feet, the bottoms, allowing our awareness to ride up through the ankles, the lower legs, the shins, the calves. And there may be some areas you feel some sensation and others not any. So just if we're able to allow ourselves to be curious, to not be judgmental. And remember, mindfulness is really allowing ourselves to be present to whatever is arising. So as much as we might want to feel relaxed and good, mindfulness is about, can I be okay even if I'm not relaxed? Can I be okay even if there's pain and discomfort in my body right now? Can I turn towards that with perhaps just a gentle, kindly awareness? So just having a sense of the sensations in both legs, in the buttocks and hips. And then turning our awareness to the torso. So the front of the body, where perhaps we can really sense the movement through the breath, through the belly, the chest. We're also at the back of the body. What do we notice in the lower back and the middle back? Can we feel the shoulder blades moving as we breathe in and breathe out? Or the back of the rib cage extending and contracting? And if you notice that you find yourself distracted at any point or get caught up in thoughts, that's okay. That's what happens. Whenever you do notice that you've been distracted or carried away, again, just gently know that this is a moment of mindfulness. Okay, I've become awake to. And bringing your attention back to the body. We can learn anything today is to really take away this nugget of being gentle and kind towards our experience, to be curious, to begin to be attentive to what is actually happening for me right now, to be present to, without judgment. And allowing our awareness to float up into the shoulders and flow of attention down the arms. So there might be some tingling or vibrations or pulsing. And noticing the sensations in your hands. Sometimes when we bring awareness to our hands, we can have a sense of increased sensations, perhaps increased warmth. And then now allowing our awareness to embody the back of our heads, the top of the head, and the front of the face, softening around the eyes, around the jaw, around the brow. So this sense of softening and opening. We'll give our body the permission to do that. And then now with a broad awareness, taking our awareness to the whole of our body, just this sense of right now, we are all breathing. You're able to breathe into your body, and this breath that you are taking in, this gentle, soft breath, if there's a sense of breathing in, slight pause, breathing out, that is really just softening and allowing the body to be safe, allowing there to be healing, allowing the body to repair. So just taking a few deeper breaths now to really anchor back into the breath, back into the whole of your body, the sense of your whole body breathing, that every single cell, the trillions of cells in your body are breathing, taking in the oxygen. And then slowly turning our attention to take in the environment that we're in. And you want to just slowly begin to move the body, perhaps a little stretch if that feels comfortable. Fluttering the eyes open if they were closed. And coming back to this space. And coming to join us all when you're done. Thank you all for taking part in that. We have a few minutes before the end of the session. My goodness, how quickly the hour goes. So it allows us to have a few moments if there's any questions or thoughts about anything that I've shared.
Thank you for that, Santa. It was very relaxing. just had to put aside, tell everyone, the person behind me, I was like, I'm not asleep. I'm on a mindfulness session because I'm in an office. I needed a sign on the door. It's like, no, I'm not having a nap. I'm just being mindful.
Exactly. I love it. Well, thank you so much for taking the time in your office time, your work time.
I'm at work because this is going to help the people that I work with, because I'm an NHS health coach. So it'll help.
Yeah, absolutely.
But my question was, do you, it's not pain related, but it's related to mindfulness for PTSD in your work, and if so, where can I find things you might have written or access all the things for that?
Yeah, absolutely. So you can find me on the Breathworks website. So there's links going in there. And as I said a little bit earlier about when it comes to PTSD, when it comes to trauma, you have to have very specifically trained people who have worked with and understand, because otherwise, if we're not careful, if you imagine getting people to move towards their experience could perhaps make it worse, and increase their trauma, increase their flashbacks. So there's a certain way, and I'm happy to talk to you if you wanted to get in touch as to how we could work with that and how we could.
Thank you. That's more on a personal level for my daughter, to be honest, of bullying at school, and it's so similar watching Mark, like with his primary experience and then piling. That's exactly what she does with all sorts of things. And then I was like taking back and realizing she's at that stage on herself where she's realized she's never going to get rid of it because it's her memories at school. It's part of who she is, but kind of how that can help her in the right thing.
Context,
but like I say, bear in mind she's a teenager, so anything that comes out of my mouth is literally trash. What do I know?
I know teenagers it's a very difficult time. It's more likely to have a lot more negativity in those years as well. So, but there's a lot of really great organizations working with young people on mindfulness as well. So that would be the other angle to go on.
She's got a couple of apps, and there's all sorts of things out there for younger people and for mindfulness as well.
Absolutely.
So
but as I said, if you want to get in touch personally, I can definitely talk to you about some of the other angles of what that can be. Mark?
It's fascinating.
It's great. Thank you for your comments.
Thank you.
Yep, Mark, you had your hand up.
Yeah, I'm just going to read a couple of comments out from the chat. So Pallavi says, thank you for the relaxation. John says his headache has gone. That's good to hear, John. And I'm not quite sure, it was Cranshaw CO1. Thank you very much for putting on the session. It was very relaxing. Anne says primary and secondary experience makes perfect sense. Thank you. Pallavi again says she will never see a raisin in the same way again.
Quite a lot of people think, oh my God, this thing that I've seen ever since I was a kid, and now suddenly I'm relating to it. And so imagine how many other things in our lives, we kind of just take for granted that we notice, but we've actually stopped seeing truly for what they are, or what's actually going on in the moment experience. It's really good to kind of retune ourselves in that way. Okay, any other questions from anyone? Any other thoughts before we conclude today's session? Scarlett, go ahead.
It's a thought, really. I'm glad I did this because I've been doing mindfulness for a very, very long time. And when I have fibromyalgia. So when I was diagnosed, I will really put it into practice. But there was something last week that made me realize that focusing on the thing actually was making it worse. So I don't know what's shifted, because this week, I don't know, but there's something in there that you've told us has shifted again. So it's feedback, really.
No, thank you for sharing that, Scarlett.
It's kind of worth doing both the courses in a way. Because in a way last week I was like, okay, but then it's really making me aware of my pain.
Mm-hmm.
And then I was realizing that I use a lot of diversion, which I think can be useful, but I use it too much.
Mm-hmm. Mm-hmm.
So now I feel like I've got that balance back.
Wonderful.
So
Yeah.
thank you.
Thank you, Scarlett. And the thing is, I'm only just touching upon very slightly, because we only have an hour. And really, as I said last time, if this is something that's touched you in some way, that makes a bit of sense, then really, honestly, the best way forward, just, if you don't want to do a Breathworks course, that's fine, but just to go and explore a course, because that's where you really get to involve yourselves, to really get to try out all the different practices and the meditations, and just see how your journey just in an 8-week course can be vastly different as a result of taking the course. So really, really worth doing. I suddenly, as I said last time, it's been transformative in terms of how I relate, not just to my pain, but it's actually every part of my life. It has become a way of life. It's no longer a thing that I add to my life. So it has a huge impact. So thank you, everyone, for being here today. Really appreciate it. And Nikki's been putting in the links to the website if you're interested in finding out more. And you can find me on there if you want to kind of send me a personal message, or even just, if there's anything, you can let the Footsteps Festival know and they can reach me as well. Happy to support in any way that I can. So thank you all so very much. Take care.